Okay, we are now going to talk about your hormones after 30 days of being on them and some of the challenges that still remain and some of the positive things that should be going on at this point. So, first thing we're going to go over symptoms that should be improving or gone already. And those are simply hot flashes and night sweats. And the reason they're the easiest to get rid of is it's a dose dependent thing. The more estrogen you have, the more they go away. If they're not gone, we simply need to add more estrogen. So it's a very simple symptom to treat in that respect. Okay, symptoms that should be improving but may or may not be gone at this point: insomnia, mood swings, and changes in your cycle. Progesterone is the big player here, and it's the big one that helps with insomnia, mood swings, does that by elevating GABA, the inhibitory neurotransmitter we talked about in the first appointment. And a lot of times, women, when they start taking progesterone, their body starts kicking back in and trying to make its own cycle again. And so we'll have some breakthrough because the body's kind of fighting what we're imposing upon it. And the ovaries are kind of spurting, working in spurts, so it's hard to control. This is all very normal. If you do have some breakthrough bleeding, always let us know, and we can try to improve it and work around it. Okay. Also, symptoms you still may be having: breast tenderness. Almost every woman, whether she had it beforehand or not, will have some breast tenderness. And this is simply because you're going back to a younger physiologic age where you have more estrogen, you have more progesterone, and therefore you're going to have some breast tenderness. The sensitivity should go away after 3 or 4 months, but after the second month, it should be improving, not getting worse. So if it's getting worse, you need to let us know so we can change the balance. Breakthrough bleeding we spoke about. Libido. Libido never goes away before the third month. And the reason for that is all the other symptoms usually in women need to rectify before libido becomes a beneficial thing. And that's simply because women work differently than men, and they have to have hot flashes gone before they start thinking about their libido. They have to have a good night's sleep before they start thinking about their libido, and so on. The one that most women hate us for is bloating. The first month, it's not uncommon for a woman to put on 3 to 5 pounds, and I can hear in the voices right now the anger. What do you mean 3 to 5 pounds? I'm not supposed to be gaining weight. And you're not supposed to be gaining weight. It's your body's adjustment phase. What will happen is the first month you may gain 3 to 5 pounds, but at 6 months down the road, there'll be a net loss, usually of about 10 pounds. So hang in there if this is going on. Important things to remember. Your body is not a stagnant system. It is constantly changing. For instance, if you lose 5 pounds, you've lost estrogen, because estrogen factories are in the fat cells. You've got aromatase. Aromatase in fatty tissues manufacture estrogen. If you lose 5 pounds of fat, you lose estrogen making machines there in your fatty tissues, which therefore get rid of the TBG, the thyroid binding globulin. You now have more free thyroid and your metabolism speeds up, the opposite of what it does when you gain weight. So it's a very good thing, but however, we do usually need to adjust your estrogen if that happens. And that's what we just discussed. A change in weight is a change in estrogen level. Secondly, adrenals have a very profound impact, yet they are subtle. DHEA helps tremendously with dry eyes. Women don't think about dry eyes, nor do they think about them being a menopausal symptom. But DHEA can help immensely with this. It can also help, believe it or not, with libido and hot flashes. They are precursors to other hormones as well as having their own intrinsic value. Pregnenolone is a wonderful medication that helps with mental acuity and it helps with inflammation. Just generalized inflammation, it helps to reduce that. Furthermore, having a good level of pregnenolone makes the body's cholesterol level relax because it's no longer trying to make hormones that it's unable to make. So we've seen plenty of women that their cholesterol levels have gone down. We've seen plenty of women whose blood pressures have improved. We've seen women getting off of antidepressants. We've seen all kinds of great things that happen over time. But remember, it's a time-related thing. We need to be able to make adjustments. We need to be able to get your input. This is not us telling you what to do. This is us telling each other what to do and what's going on so that we can make the changes. It's interactive medicine. And when we finally get it, things will click. You'll be feeling great. But know that things can change at any time also. So keep that in mind. Also remember that this is not standard medicine, one doctor, one patient. You have a doctor, a practitioner, you have 3 clinical pharmacists, you have an RN, you have an MA, you have an entire team on your side, and any one of us can help you. So if you need help, you know how to reach us. We'll be there for you. Just let us know. Good luck, and let us know how you're doing after the next month.